Good day, ladies and gentlemen. I am Lakato Letala, registered nurse midwife here at Beautez Pharmacy. So today I'd love to take you through the iron as a supplement. So as we all know, iron is just an essential mineral that our body needs, and it needs it for HP production. HP is a protein found in the body that carries oxygen throughout the body. This shows how much important iron is in our body. So our bodies automatically they produce their own iron. But in cases where limited iron supply is found in the body, this is where we need to supplement with tablets or any other forms of iron supplements. I'd love to take you through the benefits of iron in the body. So naturally in our bodies or any supplement. Firstly, iron helps with energy levels. Like I did explain earlier, it goes to our whole production of oxygen, and oxygen is the gas of life, and it's needed for energy to help us carry out through the day. Another benefit of iron is help reduces tiredness. So as we take our iron supplements or the iron our body produces, it goes to reduce the tiredness and the fatigue. And also it helps to improve saturation of oxygen in the body. I think iron is to produce HP. HP and it will transport oxygen throughout the body. And we have brain functionality and focus. Iron is able to focus or us as adults, for focusing and brain functionality. Those are the importances of iron. I hope you like the importances of iron. Iron in a mineral it gets it and a apa in supplement. Many more mineral also most of the the adequate iron is so right now, we talk about the signs and symptoms of low iron. So secrete enough iron. Low levels of iron in her body. At this juncture, I'd love to take you through the signs and symptoms of low iron levels in the body. When I come out, how level is iron in melee. Firstly, benefits iron to boost the energy. Therefore, the first sign and symptom low levels of iron is fatigue. People present fatigue there is no other disease approved. The blood glucose level is there is no illness, there are no signs of flu, but that probably there might be a deficiency in iron. Secondly, poor concentration or poor concentration. It can either be in students or us as adults. How focused you are trying by all means. You wake up on time, but you can't concentrate, and it can be another sign you have low levels of iron in your body. And dizziness can be caused by a lot of symptoms like blood pressure, but iron levels there is dizziness. So that is when we are going to suspect this person might have low levels of iron. Another one, we also have that is whereby there is no blood circulating or oxygen circulating. So in the eyes, normally if it's the conjunctiva, and this is where we look for the redness. If the conjunctiva and then we are going to rule out for this person has low iron levels. But any days I get health professionals, but at home we can take it as a assignment training. Okay, this person can iron that is another symptom of low levels of iron. Another one, is mostly in pregnant women. But we crave mobu. It is also called pika. It can either be craving of non-nutritionous objects. It can be paper. They just like eating non-nutritionous objects. So I had high risk of getting that symptom. So right now, I'd love to take you through which people or who is eligible for taking iron as a supplement. So now that we have address the signs and symptoms, then we will know when somebody presents with those symptoms, then definitely we might need to supplement with iron. So firstly, we are going to talk about at risk as pregnant women. Pregnant women, we all know that in pregnancy there is that 50% increase of blood volume. Therefore, blood it will supply the baby and the placenta. Therefore, it means they need more iron supplies so that there is enough iron for red blood cell production to carry her through the whole pregnancy, to protect the baby, to help in developing of the baby. After pregnancy, after delivery, they to take this iron supplement because they're like, I'm done with my pregnancy. That is a very wrong concept. They have to continue taking iron supplement because most of them lose a lot of blood in delivery. Therefore, they need to supplement to help the body recover. Also, this iron is also essential for prolactation. That is developing or establishing of good prolactation, or breastfeeding. Therefore, it will be able to go mme wa mokgatjhane kapa mme wa motswetse a be le lebese le lengata go tswa go iron ya di-supplement. So another group of people that can take iron supplements are those people experiencing heavy menstrual cycles, like that is the females. So if you are a female and you experience heavy menstrual periods, it is highly needed you take iron supplements. It's not necessarily for a prolonged period of time, but even if you take it for 2 to 3 months, that will be enough to supply or give back to the body the essential iron that you need to produce more blood that you lost through your menses. Another group of people can be people with chronic illnesses like kidney diseases. The kidney is the side where there is erythropoietin, which is a hormone. That hormone helps in red blood cell production. So, motohasanali kidney diseases, it means that function ya kidney it produces that hormone to sanka production of red blood cells. It will be compromised. Therefore, kidney illnesses iron. Even though but they really need iron because the kidney function is compromised. If we look at another group of people, in children and adolescents, active, they're always going all over there. They need iron highly for growth and development because they use energy throughout. They're always active, playing. Therefore, they need iron to help in boosting more red blood cells production, hence more oxygen in the body. Lastly, we have vegetarians. As for vegans, they rely on plant-based iron. So unfortunately, plant-based iron has a non-heme iron, which is slightly absorbed by the body. That says but less iron intake in their bodies. Therefore, body vegetarians are highly advised for supplemented iron. Yes, we know there are other forms of plant-based iron that you take. So, to some who produce iron, but they're highly advised to take iron supplements because of that problem. The plant-based product did a very non-heme iron is having absorbed well by the body. So at this juncture, I'd love to show you the formulations which we have in the iron supplement. And the main factor is the iron supplements, we have to check the amount of elemental iron in it. So the amount of elemental iron, okay, this iron is enough for me to take. It will meet my demand and my requirement. So with me here, I have Patrofe as an iron supplement. It has the high elemental iron in it. And another advantage about this, it's a mouth dispersible iron. It means you just put it in your mouth, it dissolves. So one thing about mouth dispersible is that they have 100% bioavailability. They go straight to the bloodstream, difficult to be metabolized by the liver. So this is the highly recommended iron supplement. So the second formulation, we have the Ferrimate capsules. They have the medium highest elemental iron in it. Therefore, they are also advised, or you can take it once a day. And thirdly, we have iron chelate. It has the third best elemental iron in it. Therefore, it is also good. Lastly, we have ferrous sulfate, which has the least elemental iron in it. Therefore, we would need to take it 3 times a day to compensate or to give us the best iron supplement that we need. In conclusion, I'd love to take you through this iron ferritin deficiency rapid home test I have with me. So this test basically checks for the amount of ferritin in our blood. Ferritin is a protein that stores iron and releases that iron into the body when our body needs it. Therefore, when we have low levels of iron in our bodies, ferritin releases that iron. So this test basically checks that ferritin levels, and it will check how many or how much of iron stores do we have in our body. Just like any other home test, it will determine 2 lines and 1 line. Therefore, when we have 2 lines of a ferritin test, they show normal levels of ferritin in the body. They show that there is positive ferritin in our body. It will release iron. But one line on this test, it indicates low levels of ferritin. That shows that enough iron when the body needs it. Therefore, it's very crucial to identify the anemia apart from going to the lab test, but it is very convenient. You can use it at home. You just prick yourself, ferritin. Had 2 lines, it means everything is positive. But when there's only 1 line, it shows there are low levels of iron in the body. This brings me to the end of my presentation, and I hope everybody is well learned about iron. We'll take appropriate measures. How about our neighbors at home, our children, very slightly symptoms. Then you suspect, okay, maybe this person has low levels of iron in the body. I neglect the iron. Thank you very much. Once again, registered nurse midwife at Beautez Pharmacy. Thank you.